let's dig deeper and let's talk about something called thyroglossal duct cyst on ultrasound. Let's define what a thyroglossal duct cyst is. This is just a swelling or a lump or a cystic lesion that forms in the neck region from the remnants of the thyroid gland cells. What happens is you will feel a swelling or you'll feel a lump in the neck region, and you'll go to the hospital to see exactly what is happening. And most of the time when you go to the hospital, they'll give you medication thinking that maybe it's just a node or swelling, that maybe if they give medication it's going to go away or is going to clear. But most of the time this does not go away. And on subsequent visit to the hospital, you might be advised to do an imaging procedure, an imaging examination, just to see exactly what is happening in your neck region, what the swelling is all about. And when most of the time, whatever they're going to advise you to do is an ultrasound. And an ultrasound is a very simple procedure and is a painless procedure. Once we do the scan, we are going to see just a hypoechoic lesion or a hypoechoic swelling, or an anechoic lesion with maybe sometimes with internal echoes, depending on if it's hemorrhagic. Hemorrhagic means it's bleeding within itself, or if it's infected, sometimes you might see an abscess formation. That just means that maybe there's some few internal echoes within the cystic lesion. Once we see this, most of the time our diagnosis is going to be a thyroglossal duct cyst, and ultrasound is one of the major tools that is used to diagnose this, because it comes up with 100% specificity in terms of diagnosis. So if you have a swelling in your neck region, if the swelling is not going away, kindly visit the hospital, and I'm sure once we do some of these procedures, we'll be able to come up with a diagnosis, and you will be able to be treated, you'll be able to be assisted, and you'll be able to be fine. Because some of these lesions, they can be very painful, they can be very uncomfortable, and sometimes they can make your life very uncomfortable. So actually, don't fear when you go to the hospital and you're told to do some of these procedures or an ultrasound scan of the neck to rule out this. Just go ahead and do it, because we will, I'm 100% sure that you will be assisted. Always thank you very much for following me and listening to me, and I'm always just looking forward to speak to you in my next video. And I've always said that once I speak, the information I give is just to help each one of us, so that at least we can improve the quality of our life. Thank you very much, and have a great day ahead.